right, 6 minutes after 11 o'clock. Thank you for tuning in. Dr. Dudley Danoff is on the phone. He's been with us many times before. We haven't met him in person yet. But
No.
One of these days we will. I want to make sure I put the cover of his book on the podcast. But first, let's say hello to Dr. Danoff. Dr. Danoff is a men's health expert. He's the founder and president of the Cedars-Sinai Tower Urology Medical Group in Los Angeles. He's a urologist to many Hollywood stars, so he's seen a lot of private parts of people who are getting their private parts talked about right now because they're not behaving with their private parts.
Exactly.
And, he's going to talk to us about the book, The Ultimate Guide to Male Sexual Health, and some New Year, New You kind of ideas, New Year's health resolutions for men of all ages. So let's say good morning to Dr. Dudley Danoff. Good morning, Doctor. How are you?
I'm doing great. How are you, Larry, Robin?
We're doing pretty good. You're in LA right now?
I am indeed.
How's the fire situation? Is it affecting you?
Yeah, it's very, it's very scary. It's in our neighborhood. You see the flames and the smoke all around. It's frightening. It's really frightening. It's overwhelming.
I think it was just the way you said it that made Robin laugh.
Yeah, I know. It's like you're just real calm. You got flames everywhere.
The only good thing I can say about the fire, my daughter lives a little west of us, and they were forced to evacuate, so I had to spend the evening with my little new granddaughter.
Oh, well, that's always nice. Yeah.
Thank God the house was safe, but that's about the only bonus I can think of about the fire.
Yeah, right. That's beautiful.
And isn't that the best part about sex, really, is that you end up with children and grandchildren? Isn't that really the best part, ultimately, right? Right?
I'm not sure whether it's children or grandchildren. Anybody that has a teenager deserves it. If you can live through that and get to the grandchildren, then it's very gratifying.
So I want to ask you something, and I don't know if this is exactly appropriate for what you do, but you kind of are very aware of men's sexuality, and I have a question about this regarding all of these accusations against inappropriate behavior of men. Okay, and so I just maybe this is just asking one man asking another man an opinion, but it seems to me that we have a sex drive that gets out of control, and guys who normally wouldn't be violating other people's space, people who normally behave. I'm guessing Matt Lauer in every other thing in his life probably behaved okay. Somebody like Harvey Weinstein, it sounded like he was kind of a bully all the time, so maybe it doesn't apply to him. But people who normally behave somehow get pushed to the point where they're going to misbehave and actually offend somebody because the sex drive is so strong. Can we blame it on the sex drive? And does it not occur in women? Do they not have that strong of a sex drive to actually break the law to get what they need? Well, if that makes sense?
I think the difference basically between a man and a woman is testosterone. So it's the testosterone that gets in front of your brain. I think it's also a message of the time. So at one time, leering, I'm not sure groping, and I'm not sure, masturbating in front of a woman was the appropriate thing to do, but certainly aggressive behavior in men in the male species is not unusual. And as a health professional, I blame it on testosterone. Now times have changed, and what was acceptable behavior or marginally acceptable behavior 30 years ago is no longer acceptable. So there's a lot of women's power that's come into it, but at the end of the day, it is testosterone, and we have to learn to control it and respect the prettier gender.
Yeah, I think so. Yeah.
Do men get testosterone pills like women get estrogen pills?
Well, so you cannot take testosterone by mouth because it's very toxic to the liver. So we can give you exogenous testosterone. We call it TRT, testosterone replacement therapy, and we give it by a patch or a cream or gel, something absorbed through the skin, or by injection. So we only give it if a man's serum testosterone is low. If you give it when your serum testosterone is normal, It'll shrink your testicles, and it's juicing. I mean, that's what the athletes do. They all have normal testosterone, and then they take exogenous testosterone, and you see these guys with the huge muscles and the weenies.
Oh,
Well, you see that part. We don't ever see that part.
so
Take my word on that one.
so does that affect their ability to fertilize the egg then, if they do something like that to have
Oh
children?
yeah, absolutely. Many of these bodybuilders have tiny testes and are subfertile.
Tiny testes. That's your next book right there, Tiny Testes, and what you can do about it. So in male sexual health, I know you cover a lot of things that are physical of nature, so I want to make sure we don't miss out on that, otherwise we're not being fair to the book. But it just seems like it's, and I guess it's not just emotional, maybe it is if physical, if testosterone is partly to blame.
Yeah, but you know, the raging bull has to be confined. He has to be trained. He has to show restraint. He has to show respect. And I think what you're seeing out there, well, certainly you see a few nuts. I mean,
Right.
Harvey Weinstein is a wacko job.
Yeah.
I'm not sure that Matt Lauer. I mean, he certainly doesn't impress me as being a wacko job. He probably just did some things that are inappropriate, and I think the same for Al Franken.
Right.
Some of these weird things that have been reported, I mean, that's, beyond the pale. I mean, that below Psychiatry 101.
Okay, and just to stay on this topic for a second, if for example, all of these guys we're talking about had significant others in their lives, it seems logical that would be the way to handle the testosterone urge, I guess, right? I mean, just go to your wife.
Well, I mean, it seems intuitively logical, but in fact, many of these guys do have stable relationships, with a wife or a steady girlfriend or a significant other, and yet they're out there, doing stupid things. I mean, what happens when a man gets an erection is all the blood, runs from his head.
Right. Yeah, tell me about it. I'm teasing. All right, so the New Year, New You, New Year's health resolutions for men of all ages. Do we as men have expectations that are not normal because we are exposed to so many fantasies like pornography or even just a normal movie where it kind of makes a guy out to be more virile? What's the word, Robin? Virile?
Yeah.
Virile?
Good word.
Than would be normal?
Well, I mean, I think everybody understands, for example, in pornography that they run it backwards and forwards, and it's magnified, and it's an illusion. It's not really happening. And I think most normal men, put those kinds of images in proper perspective and don't say, I'm that guy up on the screen. I mean, there's no question that pornography stimulates men. I assume it stimulates women as well. But it has to be put in perspective if your psychosexual development is normal.
Yeah, but what I guess the reason I wanted to bring that into this conversation is because if I'm looking at the title, New Year's Health Resolutions for Men of All Ages, and we're talking sexual health, could I read the book, for example, and be happier with my sex life or with my health in general?
Well, I think the object of the book, and certainly what I've heard from many people, is I wish they had read the book 20 years ago. So I think you would be enlightened about the way things work, and I think you would have a better understanding of why you do what you do when you do it. So I think it's on both levels. People have found it very, very helpful. I have an insight because, unfortunately or fortunately, I've seen more penises than can fill the Rose Bowl. So I do have a little insight.
That's a T-shirt slogan for you right there.
Yeah, Doc, is this normal? And I think I have the authority to say absolutely normal.
Do all men of all persuasions go to see their doctors, or do straight men go more often?
Well, let's compare men to women. I mean, a woman would not miss her yearly pap smear or mammogram. I mean, a man in his 40s whether he be gay or straight, should be coming in to his doctor, his urologist, once a year and get his prostate exam and get his PSA, prostate-specific antigen, a blood test, testing for the early diagnosis of prostate cancer. You've got to push him. The man is macho. He doesn't want to admit there's any frailty. He wants, to catch the pass in the last 30 seconds of the Super Bowl. And,
yeah, right.
And I find, as far as health is concerned, gay men, and I certainly have a substantial number of gay men in my practice, are basically no different than straight men. They have the same anxieties. They have the same desires. The object of their affection is different than the majority of men, but the feeling is the same. The psychosexual drives are the same. The illnesses are the same with some exceptions, but no difference.
Yeah.
And it's interesting. When I wrote the book, I try to make it in the second edition gender neutral. So when I talked about men, I try to include gay men and heterosexual men and bisexual men. Well, from a sexual health point of view, all the same, Larry, all the same.
I would think so. The one thing that, as a straight guy, I can't understand. I can, but I can't. Is how if we're visual creatures. Everybody says men are visual. We like to look at stuff, right? But a gay man looks at another man and has the same reaction that I might have looking at a woman. That's the part I don't understand. What happened there?
Well, just as there are, quote, beautiful women, and there are criteria for beautiful women, perhaps, large breasts, perhaps, a well-curved behind, small hips, turned up nose. I mean, there are criteria for beautiful men. Well muscled, well proportioned.
I have never seen one.
I'm teasing. You ought to work out. You ought to work out.
I'm teasing.
Hollywood. You see some buff guys, and if you think of yourself, as a gay man, look at you say, wow, that's a beauty. Hello there.
There you go. Is a man having a urinalysis the same as a woman having a pap smear? Is that something that needs to be annual?
A urine analysis and a pap smear are different. A urine analysis tells us lots of things. It tells us about kidney function. It tells us if you have sugar in your urine. It tells us if you have an infection. It tells us if you have blood in your urine. A pap smear is a specific test for cervical cancer. Mm-hmm. It's like a scrape of the cervix, looking for cancerous cells. And a urine analysis is like a chemical test. It's like a blood test. It tells us many things about many organ systems in the body. So the two are mutually exclusive, and a woman should have both, and a man should certainly have a urine analysis, and I would say the equivalent would be a PSA, this prostate-specific antigen, the blood test for the early diagnosis of prostate cancer. And we've talked about this before, but the key to the cure of prostate cancer is early diagnosis. So I would equate the pap smear to the PSA.
And you also talk about a digital rectal exam.
Yeah. So in a woman, a breast exam would consist of feeling the consistency of the breast, any lumps or bumps or asymmetry or irregularities. And the digital rectal exam is done with a gloved examining finger. It's done through the rectum because the prostate anatomically sits just in front of the rectum. And the urologist is, again, feeling for lumps, bumps, asymmetry, nodules, and that is another way to diagnose illness in the prostate with specific reference to prostate cancer.
Gosh.
I have a question for you that doesn't even seem related, but it is. Have you ever looked to buy a motorcycle on the internet?
No?
Something's coming. I feel it.
I have not.
No. Okay. Well, some people at the radio station do this. They look for motorcycles on the internet, and then the computer will automatically show me, like, if I'm not even looking for a motorcycle, it'll show me these little motorcycle ads. Okay.
Right.
So in order to prepare for this interview, I had to go to the ultimate guide to menshealth.com, to your website. And now I'm getting all these little ads on here. And I have to ask you about this one I'm looking at right now. It said, you won't need Viagra if you do this one thing. And I'm supposed to click on it to find out what that one thing is. But I'm not going to click on it because I don't want to...
Well, you know, I actually have no control over that. No control over those little ads. They certainly are not, my ads. And I don't know how the...
Oh, I wasn't implying that. I wasn't implying that.
No, but somebody hooks onto it and says, well, if you read the Ultimate Guide to Men's Health, you must be interested in men's sexual health.
Right. So, but
top of the list, Viagra.
But I mean, if you were in the studio and I could show you this little ad, what is your response when you see those kinds of things? Of course, I didn't click on it, so I don't know what it's really advertising. But if somebody says you don't need my Viagra if you do this one thing, is there really a one thing you can do to correct whatever Viagra is supposed to correct? Which is
you can certainly buy the placebo that they're trying to sell you, which is probably sugar water, at about $30 a pill. I don't know. I don't think, Viagra has a very specific physiologic action in the body. It increases blood flow, and, maybe, looking at a pretty girl, if you're a straight guy, you increase the blood flow by that.
Oh, okay.
I, as a urologist, can't think of that one...
So what?
One thing, yeah.
So what kind of improvements are men mostly asking for? Like, do they come see you? Hey, doc, could you make me bigger? Could you make me last longer? Could you make me? I don't know.
Have more.
Have more. Produce more.
So starting with can you make me bigger? So I can assure you that there's absolutely no legitimate way.
Okay.
Your penis larger. It's genetic. You're born that way. And a really interesting thing is that in all the years I've been in practice, I never heard a woman come and say, could you make my man's penis longer, fatter, wider? Not one woman. I've heard them say, can you make it a little bit firmer and attach it to a sweeter guy? Preferably with an American Express card. So,
there you go.
It's men that are obsessed with size, not women. I mean, look, there are preferences that women have, but they care about a sweet, firm, nice, loving, cuddling, sexy guy. That's what they care about.
Okay. So what about the other thing? What do they ask you for?
Oh, well, obviously, Viagra, Cialis, Levitra, those drugs are $1 billion drugs. So every man is concerned about, getting an erection that's firmer and lasts longer, and those drugs fit a void, they fit a need, and they've been tremendously successful drugs. I mean, beyond anybody's imagination.
Do your younger patients, the men who truly are sincere about wanting to get their wives pregnant, do they ask you for help with that? Like, let's say they've been trying and it's not working, maybe they're blaming themselves. Is there a way...
Yeah, I mean, certainly we have an evaluation for what we call infertility, the inability to impregnate your partner, and we certainly work on that. So there are medical causes, there are physical causes, there are chemical causes, and some of them are correctable, and there are many things that we can do to help an infertile couple conceive. So that's a big part of what we do.
And you do talk about nutrition. I mean, that really does seem to be first and foremost.
Well, without good health, you don't have good sex. So, low-fat diet, high protein, limited sugar, limited alcohol, exercise, lean and mean, upper body strength, lower body strength. I mean, to have good sex, you've got to be physically fit. Mm-hmm. And if you want to look down and see a longer penis, you don't want to see, a belly, which they Dunlap, as they say. My belly doesn't lap over the Dunlap syndrome. Belly doesn't lap over my belt. I mean, the penis comes out from under the pubic bone, and if a man is fat and he has 3 or 4 inches of pre-pubic fat, the penis comes out through that, and it looks like, oh my God, what happened to my penis?
You have such a great bedside manner, because men, about your health, you have to have somebody that you can have an open conversation with, and not think that, well, if I ask this, the doctor's going to think I'm silly.
Well, I think, knowledge is power, obviously, and, if you're doing what I've been doing for nearly 40 years and don't have a sense of humor, I feel sorry.
Really. So does the book answer a lot of questions that typically would be asked?
Yes, it does. It's written in very straightforward, easy to understand language. Obviously, it's a little bit tongue-in-cheek, lots of facts, and it's just gotten a great response, overwhelming. I'm just amazed.
And how about a man's emotional health?
Well, how do you speak to that? Emotional health comes from within. It comes from support of family and loved ones and around you. And for example, self-doubt is a self-fulfilling prophecy. Certainly, when it comes to sex, am I as good? I think I'm going to be. Do I have performance anxiety? Another killer. So psychological health and healthy sex are hand in glove. They go together.
Doctor, thank you for being on the air with us. Do you celebrate the holidays?
I do indeed. All of them. we have an Italian in our family, a Presbyterian, a Jew. We have a long time lady that helps us in our house who's a Muslim. So we go right across the board. We have a Hanukkah bush, we have a Christmas tree, we have.
Oh, that's wonderful.
Well, have a great holiday season. Stay safe with all those fires around you in Los Angeles. And for everybody else, the book that Dr. Dudley Danoff wrote is called The Ultimate Guide to Male Sexual Health, and the website is theultimateguidetoMen'sHealth.com. And get a copy of the book. I'm sure it's available in bookstores as well. Am I right?
Yeah, bookstores, Amazon. The whole 9 yards.
Okay, excellent. Again, have a great holiday season. Thank you for being on the air with us, as always.
Pleasure, Larry. Pleasure, Robin. You too.
We'll be right back.
Hey guys, looking for something unique? Then try TripAdvisor's #1, the Gypsy Gold Farm Tour. What's so special? Your 2-hour tour begins with one of the most unique stories in the annals of equine history and continues with a walk to meet historical gypsy vanner horses and more. Photo opportunities and a gift shop await your holiday visit. Tours are every Wednesday, Friday, and Saturday from 10 a.m. until noon. Only $20 per person. Children 5 years old and under are free. Book now at gypsygold.com.
Get it for less at the DIY Home Center outlet. Get top quality real wood cabinets the same or less than the big box stores are selling the cheap stuff. And that's not all. Drywall screws big box stores are $6.49